The final shots in stage 1 of Otago's Meningococcal B Vaccination program. Liberton Christian School in Pine Hills, one of the last schools to be visited by doctors and nurses from Public Health South. And this afternoon, Associate Minister of Health Pete Hodgson was also present, keen to check out just how well the program's going.
Really pleased to come along to a school, Liberton Christian School as it happens, to lend my support to vaccination for meningococcal B. It is a terrible disease. I have seen it some years ago up close in a teenage boy. It's a most awful disease. That person was lucky to live, and it's one that can be avoided.
However, it hasn't been a pain-free campaign. The Otago District Health Board have criticised the health funding formula, which they say has left them with a $400,000 funding shortfall. Hodgson acknowledges there's a problem and is looking to urgently address it.
Three things need to be said, and these are quotes straight from the Chief Executive. First of all, it's not a crisis. Secondly, the program will be affected in no way at all. And thirdly, and I think importantly, Otago DHB are now in discussions with the Ministry of Health. The issue is about whether or not we've paid enough attention to the very rural nature of Otago.
Despite the funding problems, the vaccination program still seems well on track in Otago. Over the past 6 weeks, around 28,000 school students have had their first of 3 doses. Public Health South are aiming to vaccinate 90% of the 50,000 young people in the region.
I'm delighted that the uptake in Otago is even higher than it is for the rest of New Zealand, and I've come to support and thank those parents who've said, yes, we want to have our child vaccinated.
The next group on the team's checklist are university and polytech students. Phase 2 of the campaign is due to begin when school students return from their holidays in early August. Jeff Yorston, 9 Local News.